presentations and lectures that we've been doing here in social sciences to share some of the work that's happening in the social and behavioral sciences related to the current coronavirus pandemic and its associated effects. I'm very pleased you could all join us here today. This session is being recorded and it will be available on the School of Social Sciences website a few hours after the event today. So without further ado, I'd like to introduce Professor Sara Goodman from the Department of Political Science here at UC Irvine. Professor Goodman is an award-winning author whose first book, Immigration and Membership Politics in Western Europe, won a number of awards. She's currently at work on a second book called Citizenship in Hard Times. We are indeed in hard times, so I'm eager to hear her perspective on the work that she's been conducting since the pandemic began with the support of the National Science Foundation. And Sara, I'll just hand it over to you. Thanks so much for doing this.
Thank you. Hi, invisible people. I'm so happy to be here today to share with you some early findings that I have with some colleagues, Shannon Gadarian at Syracuse and Tom Popinski at Cornell. I'm Sara, and today we're going to talk about partisanship and policy preferences during the pandemic. You can tell I'm teaching alliteration to my 7-year-old at home. So I want to start off with how I came to this project. A lot of my work is on Europe and the politics of immigration, as Bill mentioned. And by mid-February, it became kind of clear that this enormous outbreak in China was starting to spread. And I was in Europe at the time, so I was in airports, reading international news, and I saw that European leaders were discussing mitigation strategies and travel restrictions, and that discussion was not taking place in the United States. So after the travel ban or travel restrictions from China implemented the 2nd of February, there wasn't much else taking place compared to European leaders. And so I kind of noticed this comparative difference and started to kind of take note what was happening in the United States as cases began to grow. And so as we started to read in the United States about this huge outbreak in northern Italy and in parts of Europe, we were still belated, bungled in our response and our policy, and very reactive, right? Nothing proactive was happening, even though these incidents were sort of dominoing globally. And we didn't impose travel restrictions here until March 12th from Europe. And so, we're looking at this and we're thinking, well, it's going to come to the United States. The function, the question is in what form. So that takes us to where we are now. We see American exceptionalism, but in the worst way. So this project asks how this happens. So we take a comparative perspective on policy design and policy decision, looking at elites cross-nationally, and we also look at individual behavior and at attitudes. So I'm going to present from that second half today, evidence on individual behavior and attitudes. Why, or I should say, what do Americans do and believe in response to COVID-19 and why? So let's kind of start with an anecdotal perspective, right? What are we doing? So Americans are having this, we're in this crisis and we're in it together, right? Flattening the curve requires that we're all pulling together, we're staying at home. These are the messaging from California state health agencies or from California State Agency. We're supporting our essential frontline workers. So we're at home, we're doing this, right? We're making masks, or we're calling in on Zoom webinars. We're having Zoom happy hours with our friends. We are teaching number bonds in the Common Cores to our children. We're making bread, right? So we're all at home in week 800. I don't know how long we've been at home. Meanwhile, right, others are doing this. We know that, people are meeting at parks in Brooklyn, or they're going to the beach, famously in Huntington, or they're doing this, right? They're protesting. They're demanding that we reopen the economy, or even this, drinking bleach, Lysol. So we have even an anecdotal sense that not all Americans are kind of responding similarly, pulling together in this together. So what we're doing in this project is we're asking what COVID-19 is doing to American politics. What makes America unique here is not the virus, the public health crisis is that it is political. So we're looking at the politicization of this public health crisis. The politicization in terms of rhetoric, in terms of what people and elites are saying, in terms of behavior, in terms of attitudes. And we know already that it doesn't only affect public health policy, these attitudes, rhetorics, behaviors. It's affecting attitudes, it's affecting participation, right? So think about the Wisconsin election. It affects trust in leaders and one another. And it's also affecting the economy or a broad range of attitudes about immigration or social issues. So we look at the politics of this pandemic. So what I'm going to do in this talk is I'm going to walk you through kind of why we look at partisanship. I'm going to walk you through why we do surveys. And I'm going to start showing some of the evidence that we have from running surveys, asking people about their behavior in response to COVID-19 and about their attitudes, what they think that government should do. We'll talk a bit about news consumption. So are your attitudes a function of where you're getting your news or how much you're reading? And I'll show you some really early evidence from our second wave. So we just got the data back from YouGov yesterday, so it's very preliminary, but we wanted to show you whether there's change or not. So we're interviewing the same people. That's what a panel is. We're interviewing the same people in late March as we are in late April, and whether there's change or not in their attitudes and behavior. And then we'll talk about kind of where the project is going to go from here, and I'm going to take your comments and questions. So why partisanship? Well, partisanship is among the most powerful political forces in American political life. Americans pay little attention to politics most of the time, but they use partisan identification as a really strong guide to help them choose political candidates during elections, or to form attitudes, or even to process information, right? Partisanship is also a social identity, and it's tied to other identities and even personality. So partisanship is this really strong force that helps us make decisions and provides us with a sense of identification. It also helps us, or it informs who we trust and how we feel about other people. So partisans not only prefer their own party members over the opposite party, but they also actively dislike members of the other party. We call that affect. These are negative feelings, negative affect rate about other people. So we don't just like trust our own people more, we're gonna dislike other people more. So what we think, or I should say what we know from work by Albertson and my co-author Guderian, is that individuals become more anxious in response to a health scare. And when they do, they seek out information from experts, and they increase trust in these experts. So this we know. But what we think is that when that information can't break through, when that message from experts can't break through or is undermined by elites, which we've seen in sort of daily presidential briefings, so when that message can't break through or it's undermined by elites, that we have noise, right? And so in this noisy informational environment, without expert-led leadership or solidarity cues, right, that we're all in this together, that people will sort of default to partisanship. So how do we know that, right? How can we test that? So we can ask people, right? So the basic idea here is that we run these panel surveys in multiple waves where we ask the same people over a period of time what their attitudes and behaviors are, and then we can chart, you know, continuity or change over time, hopefully up until the November election. And so we have on this survey a large battery of questions on health behavior, so things like hand washing or self-quarantining, health attitudes, so understanding the scale of a threat, the level of worry about COVID-19, health policy views, so should public events be canceled, should costs be waived for COVID-19 treatment, and other public policy views. Should interest rates be lowered? Should elections be delayed? Should air travel be suspended? And so like when we ask this question, right, over a period of time, you know, someone's opinion might change on school closures in June when they've had too much one-on-one time with their children, so to speak. So we can chart these changes over time. And we anticipate that COVID-19 will affect lots of things, right? But that these attitudes are filtered through partisanship. So like I said, we've done 2 waves so far, and this slide just kind of provides you a visual of when we took, when we had those surveys in the field. So wave 1 was March 20th through 23rd, and then we just got wave 2 back, like I said, yesterday. So I'm going to show you first some results from the first wave, so late March. The analytical framework here we're using are flexible covariate adjusted logistic regressions. I'm going to show you how to kind of read these. I think my mom and dad are watching, and I don't think that they necessarily know how to read these models. So I'm going to walk everyone through, hi mom and dad, walk you through how to read these. But just as a primer before I put the slides up, I'm going to say that just for today, for the sake of brevity, I'm going to talk about Democrats and Republicans, recognizing that they're, you know, but I also have them there independents up as an others category. So these models are representative, they're weighted, they represent sort of, they're nationally representative. So, and controlled for things like gender and race, marital status, education. So we can say, like, all else being equal, this is the role of partisanship. Okay, so I'm gonna start by looking at panel A on the left. This is your health behavior. These are coefficient plots, and you really just wanna pay attention to the point estimate here. And if the confidence interval does not cross the vertical line, then it's statistically significant. And you aren't going to see Republicans here because that's the comparison group. So what we can say by looking at this first panel here is that Democrats are statistically more likely to report washing their hands more than Republicans. So here we see Democrats across the board are more likely to report increased behavior in response to COVID-19 relative to Republicans. Democrats are more likely to avoid contact with others than Republicans. Democrats are more likely to avoid gatherings, seek information on COVID-19, self-quarantine, and then this is just a sum of all behaviors. Moving to panel B, these are your health attitudes. So this is to what extent do you agree or down here are worried on a 5-point scale. We ask a variety of items. So Democrats here are more likely to estimate a higher number of deaths versus Republicans. Democrats are more likely to agree we should increase spending, that there are not enough tests, are worried about getting sick, worried about the negative effect on the economy. Remember, this is late March. Worried that their friends will get sick, worried they can't return to a normal life, worried that schools will close. So this was also before a lot of school closures. And worried it's hard to get necessary items. So Democrats across the board here are exhibiting more worry and exhibiting more CDC recommended health behaviors. Okay. So moving on to health policy. Here we see Democrats are more likely to agree on a number of health and public health measures. Welfare and public health measures. So Democrats are more likely to support free COVID testing, waive treatment costs, close schools, cancel everything, support paid sick leave. Here we see that there's no statistical difference between Democrats and Republicans on things like compensating firms or instituting a domestic travel bans or states taking the lead. So that's what it means kind of when it crosses the line. And then finally, we can look at this panel B on the right at public policy. And we see Democrats are less likely to support economic measures. So Democrats here are more likely to support increased trade, so globalization, whereas this means Republicans are more likely than Democrats to support import taxes, lower interest rates, not be reliant on other states and make more things at home, that there should be no air travel. This means when it's on this side, Republicans are more likely relative to Democrats to support these items. Republicans more likely to support an entry ban from China, UK, Italy. We ask these different categories. close the Mexican border, quarantine individuals from China and Italy. So we see that on public policy related to immigration and economic issues, that we actually see these really strong positions taken by Republicans relative to Democrats. So I want to move on to show you a couple, how are we doing on time here? Great. To a couple of news consumption items. So we were curious here about how news consumption related to blame attribution. So this slide asks, who's the most responsible for the lack of preparedness for COVID-19? Ranking Trump, Obama, the CDC, and state health agencies. So again, recalling kind of that noisy informational environment and how individuals are obtaining cues. So in looking at this, on the far left, we see Democrats. Red is that they consume news a great deal, blue a moderate amount, black none at all. So if you're a Democrat and you follow the news, you're most likely to blame Trump. This is the Trump category, Obama, states, CDC. So like Trump is getting blame from even non-news consumers among the Democrats. When you move to Republicans, you see if you follow the news a great deal, again, that's red, you're most likely to blame Obama, strong blame for CDC. If you follow the news a lot and you're Republican, you have the least support for, or least blame for state health agencies, but really significantly, we're seeing this never blaming for Trump, right? This really strong rally around Trump effect for all levels of news consumption among Republicans. So if we think about where people are getting their news, we can also sort of investigate blame attribution a bit further. So here we look at who is responsible for the lack of preparedness, again, ranking Trump, Obama, CDC, and state health agencies about where you get your news. So on the left, we see right-wing news watchers and then other news watchers, so other sources of news on the right. So here, what we see is Democrats blame Trump regardless of their news source. There are very few Democratic right-wing news watchers in the sample, so it's very significant. But Democrats are going to blame Trump regardless of where they get their news source. Republicans that watch right-wing news blame Obama the most, and Republicans that watch other news sources are likely to blame the CDC. We see state health agencies here, and a little more blame for Trump if you're not watching right-wing news. So this tells us a lot about how sources inform information and then in turn inform your attitudes and your behavior. So like I said, we just have this new data. We interviewed the same people a second time in late April, early May. And what I want to show you here is the differences. So we want to know with this time, with this data over time, is that we can look at whether partisanship converges or diverges in time. So do Republicans and Democrats start to look similar, or are they moving further apart, having been like a month in this and under stay-at-home orders, right? Are we seeing that like on the ground changes or a rising death toll is causing convergence or divergence, right? Are we seeing that Democrats and Republicans start to look similar or not over time in their behaviors and attitudes? So, okay, this is just in case there are any economists or grad students out there, this is the model. But the point, again, is just that we're investigating convergence and divergence. And I'm going to label on each of these figures where we see that, just as a sort of heuristic shortcut. So starting with health behaviors, for example, I want to show you self-quarantining. What does this mean? It means that you want to pay attention to the filled-in dot, which is wave 1, and then the hollow dot, which is wave 2. Here we see that both sides are quarantining more. Democrats are still quarantining more than Republicans. They're moving in parallel, but the change in partisan difference is not significant. So that's why there's no change. That's why it's, we label it no change. So in looking at all of this behavioral data, we don't see much evidence of partisan convergence. Everyone is shifting up a little bit, right? They're sort of doing a little more, but there's no convergence in that they're doing it more similarly. So no change in like avoiding gatherings or buying hand sanitizer or washing your hands. Behavior remains relatively the same on that measure. Moving to health attitudes, there's no general pattern here, but note that Republicans, not Democrats, grow less supportive of increased spending, less likely to believe we don't have enough tests, whereas Democrats grow less concerned about the economy. So like I said, these are just descriptives. We don't have any controls yet, but we just want to identify the patterns that people have reported so far. Moving to health policy preferences, Democrats aren't changing much. Republicans are getting less supportive of almost everything. So we're seeing wide divergence. So short of this kind of narrative that we heard in kind of mid-April that everyone was staying at home and coming together, when we look at policy preferences or people's attitudes about what the government should be doing, we're actually seeing this wide divergence, these differences in terms of waiving treatment costs, closing schools, canceling everything, right? And this is the reopening the economy, get back to work kind of mentality that has been discussed sort of from the elite level downward from Republican cue makers or elites. Check out, then finally, we have other policy preferences. So beyond health preferences, these are the immigration and the economy items. So we see lots of shifts here. Many of them seem equal across parties, except for the immigration items. So things like banning entry or entry restrictions, where partisan differences are growing rather than shrinking. So Democrats are becoming more inclusive on these immigration items, and Republicans are becoming more restrictive. And then I wanted to highlight this one, delaying elections in the bottom right. Both Democrats and Republicans. So there's no change between parties, right? They're not converging or diverging here, but both massively disagree that we should delay elections. And again, this was after Wisconsin and evidence that people became infected as a result of in-person voting. Okay, so what are we doing next? Again, this is really early. Is we're going to keep asking more people. We're gonna move from description to causality and explaining the patterns, and do 3 more waves, hopefully, of asking people these questions. So to sort of step back and take an overview of what we saw from wave 1 and 2, we see no significant evidence of partisan convergence. We see no mobilization from the elite level towards a unifying message or for leaders that would produce convergence. And so we could really think about that first question I asked about what COVID-19 is doing to American politics and reframe it as what American politics is doing to COVID-19. Because what we're seeing is that politics is enabling the spread, it's not mitigating it. That's really worrying, right? Because where does this leave us? States are reopening, right? So if you look at this map, with the exception of Colorado, Wisconsin, Maine, and New Hampshire, this is the 2016 electoral map. So we're reopening. And as we are reopening along partisan lines, and as we're doing that, the forecasts don't look good. So we know what is going to happen in the next month alongside these very partisan policies on the previous slide. This is a real sobering slide to look at. It makes us all feel like, I don't want to say hopeless, but it's a real sad state of affairs, of course. And so I want to really conclude, not just with what we're going to be doing over the summer. We're going to look at the effects of the economic recession, right? Unemployment, I saw today, is at 14.7% now. We're going to look at racial dynamics. We're going to look at the effects of the election. But I want to say a word about why I'm doing this, why it's important to me. I mean, personally, I'm a planner, so I find that working through stress is really helpful, and this is a stressful time. But I think that what this shows us is that you could have the best science in the world, you could have testing and tracing and you can have all the CDC recommendations that you want, but if policymakers don't implement it and people don't comply, then we have a different problem, right? So it shows us, the evidence tells us that the story of COVID-19 in the United States is the story of politics. And political scientists have the skills, and because, as Bill mentioned, I study citizenship, so I study civic obligation. And so I think that there's a civic obligation here to tell that story, that we have the skills to. So support your local political scientist. I want to say thank you and for your feedback, your thoughts and questions. And you can contact me if you want to talk further. So thanks, Bill, and thank you, anonymous faces.
Great. Well, we have some questions that have come in during the talk. And if folks would like to pose a question, please go to the bottom of your screen and click on that little Q&A thing. And you can put a question there, and I'll do my best to get to all of them. But the first one is just a question of someone who I think maybe missed the beginning of the talk, which was, can you talk a little bit about the sample size and the ratio of people by party preference and that sort of thing? So just sort of a, what's your sample?
Yeah, sorry, am I still sharing my slides, or is
you are still sharing? You went back to sharing your slides, which is fine.
Oh, sorry. Can you make it so I don't do that? So I can just, it doesn't matter.
It doesn't matter, it's fine.
I don't want to touch anything. Okay.
There you go.
So what did we interviewed? Like 3,000 people in the first wave, which became about 2,400 in the second wave due to attrition. It's a nationally representative sample run by YouGov.
So just say a few more words about what that means when you have a sample that's nationally representative.
Right. So if you watched The West Wing a while ago, there was an episode like about the census and why we either interview everyone versus taking a sample. And so a sample, the idea is that you can reflect the general population by selecting a certain amount of certain groups, right? So if the general population is 50% men, 50% women, right? Then you can interview 15 men, 15 women. It would be representative because the general population is 50-50, right? And so we know that it's not that easy when you cut along racial lines or income lines or education lines. So a representative sample means that we're just interviewing a part of people to reflect the wider population. And where we can't do that entirely, we can use weights, which tells us what the general population shape looks like to make the sample representative.
Great. So the sample includes Republicans and Democrats in the proportions in which they are nationally.
Thanks. Yeah.
Okay. Just making sure to help out some of our attendees here. Yeah. And then on the slide that you just posted near the end that showed the kind of increasing cases, attendee asks, you said it was sobering and hopeless, but I couldn't understand it. Can you explain what the forecasts are as the states reopen?
That every state is that according to every model, we're going to have 100,000 deaths by June 1st.
Assuming that states reopen on the trajectory that they're on right now?
Assumes the current levels of social distancing and other interventions.
Okay. There's a, this is a social distancing question from Mary Ann. Is there a partisan divide between how people think about the incentive to social distance due to a social responsibility to the collective? Or is this overshadowed by whether or not a person thinks the virus is real in the first place?
So we asked that. We asked, we did a survey experiment where you divide the sample and you give half of them, I would stay at home to protect myself, and the other gets, I would stay at home to protect others, right? So you can change that language to see if there's any statistically significant difference between the two. And we didn't find any among those questions. We also asked questions about civic, because I'm super into civic obligation. And so I really wanted to know, right, we started to see those stories early on about people hoarding N95 masks and reselling them on the market. And I was like, do people view them as entrepreneurial and capturing the market, or do people think that they're bad citizens? We haven't looked at the responses there, but like we are asking these exact questions because the motivation is very important, right?
Another question on the other questions that you're asking, and this is from your colleague Danielle Thompson, who thanks you for a great talk and asks, did you include any questions about whether respondents know anyone who contracted COVID, and does that matter for changes in opinion between waves 1 and 2, particularly for Republicans?
Yes, so we did ask, do I have them here? We asked whether you know someone, we asked if you lost your job, we asked, are you unable to pay rent? So a lot of contemporaneous items that would reflect a change in circumstance. Are you working at reduced pay? Have you visited a food pantry? So we asked a bunch of these items. We haven't yet seen whether those are, we haven't plugged them into the model yet, but we are seeing that, for example, this is hitting Democrats harder than it's hitting Republicans. And then, of course, we also see a variety of effects when we look at white versus Black versus Hispanic versus Asian respondents on those items.
And another question that goes in a slightly different direction, this is about some of the right-wing conspiracy theories that are being posted on social media. So there's a video, there's a lot of anti-Soros stuff, and so on. And the question is, how do we explain that? How do we think about it? Is it a situation where, the political right has like released the hounds, the questioner asks, or something else going on?
Well, we don't include conspiracy items on the survey. We sort of, my co-authors and I kind of joked that we never anticipated including drinking bleach on the survey either. And we were kicking ourselves for that omission. But so we don't ask about conspiracy items, but what we do see is that consuming traditional news versus social media yields the same effects. So kind of where you're getting your news is not entirely part of the story, but of course you're seeing these items on social media versus in traditional news outlets. I haven't watched that. Plandemic, is that what it's called?
Yeah. Well, this is a related question on news consumption. And I think you may have covered this, but just to reiterate on party divergence by news consumption. Brian asks, many areas had no change, but I wonder if that would hold when you restrict it to high news consumers. So if you just look at high news consumers and forget about everybody else, what do you see?
Forget about
the low news consumers or the no news people.
Well, I mean, if you look at the, when we plot the people that consume news of a great deal, like the patterns are sort of, they're similar kind of along high, medium, and low consumption. So like if you're a Democrat and you consume a great deal of news, you're more likely to blame Trump and then like no blame for Obama or state health agencies. Whereas if you're Republican, like you see the same pattern, strong blame for Obama, versus relative to moderate versus low news consumption versus state health agencies.
So, and I know like
it's great. It's a graded scale, right? So
yeah, and you're going to get into like causality like later, right? But like So another question here from Santiago, who also thanks you, is that whether the effects observed are due to values or incumbency. If the Democrats were in office, would we observe mirrored results? So
there is other research on this. For example, a 2014 study on Ebola. There was an H1N1 study, right? That partisans support the leader in power, and you're going to have more resistance from nonpartisans, right? Partisans of the outgroup. So there is research that suggests that's true, but like controlling for that, then like we see it like at the state level, for example, the sort of the compliance and attitudinal pattern replicate itself.
Cool. There's two pretty interesting questions that have come in about, just again, asking you about stuff that's on your survey. So Shunfei wants to know, points out that attitude toward reopening might vary with people's occupation. So did you get people's occupation on the survey? And then let me give you the other one from Allison, which is, did you ask about people's knowledge or opinion of international responses? So if someone has a relative in another country or knows of a country like Sweden, does that affect how they view stuff. So occupation and knowledge of the international scene.
I don't think that we ask, I'm trying to remember, type of occupation, but we ask whether you're employed or not, whether you're employed in the home, whether you lost your job recently, whether you were part-time worker. So not the type of employment, but then I guess the nature or the location in which your employment has changed, right? Whether, so like from that, we are able to see if you have a job that can be taken, can be done at home, for example, in that instance. We ask questions about, knowledge questions we ask are about frequency of, or I should say knowledge about like a number of infected or dead in the United States in this recent example, or recent wave, I should say. But we don't ask questions about international knowledge. We have questions about immigration status, your own immigration status. We have questions about, so we have some of that kind of demographic information. And what we do, which is interesting, is we ran these experiments in the first wave about your attitudes towards banning immigration from Italy versus China versus the UK. The logic being that people are following the waves of infection, the viral spread, and that if you were following that, then you would support, banning migration from countries where it's happening versus not, right? And looking at that, we see that like your racial resentment attitudes, your xenophobic attitudes are very strong determinants of who you think should be banned from entering the United States. So we can infer from that kind of a lot of information about, and of course filtered through news consumption, we can learn a lot about what people know about what's happening internationally when it comes to the global dimension of the virus.
Related to the international thing, on the blame question, was blame China an option, someone asks, or did it like not pop up in people's responses?
We didn't.
As opposed to like Trump or Obama, or
yeah,
you didn't ask that. Okay.
We asked Trump, Obama, CDC. So this is interesting. I thought that when we pre-registered this, which basically just means we registered ahead of time what we think was going to happen, what our hypotheses are, so then we can, see whether we're right or not, and be honest about our reporting. And I thought that there was going to be a really strong effect about whether we say, whether you blame the CDC if we tell you that the director is a doctor versus the director is an appointee of Trump, and there was no difference. So that was another little experiment that we ran about the CDC director, and then state health agencies. So those 4 categories.
Okay.
Yeah.
There's as you might imagine, there's a number of questions about what you think the implications of all this are for the election. One person also, so there's a couple of questions that basically ask that, and another person also asks, since the recession may end up being worse than the Great Depression, do you think that the parties might actually come together? So implications for election, will there be any convergence?
Implications. So one implication for the election is, gosh, and I don't, I try so hard to tone police when it comes to talking about these things. So we added, let me start by saying one of the advantages of being a comparativist, which means that I study other countries. The way that we carve up political science is like, I study how countries compare to one another in terms of their governments and how they make rules and how politics happens in other countries. And so one advantage is, like, by studying other countries, is I can look at the United States and through a comparative lens and sort of question some of the things that we take for granted. So I'm going to get to your question. So we added on the second survey a bunch of items about what we can interchangeably think about as democratic work threat, democratic decline, democratic recession, things that that comparativists who look at other countries in the world worry about. If you know anything about Poland or Hungary, you're going to ask these questions about the United States. So worries about things like we need to come together in a time of crisis. Criticizing the people in charge and questioning their decisions only divides us further. So publicly questioning, right, or free speech items. People that spread false information should face legal penalties. The president should be given more powers to address the crisis without congressional oversight. So consolidation of powers and the removing of oversight. Delaying elections. Elected leaders have a right to investigate their opponents. So we added all of these items to the second wave because we're worried about democratic norms, right? Wisconsin is not just an example, but it's a warning that, and we see every day. I mean, we can look at the Flynn story from yesterday, what norms erosions, what democratic norms erosions looks like. And so I haven't had, none of us have had a chance to look at these results yet, but these are questions that we're asking. And so it's possible, we have elections and we schedule them, but then we have all these sort of practices around them that can really threaten the integrity of those elections. And it's something that we're all really worried about, Democrats and Republicans, as you saw on that, in that result between wave 1 and 2. So of course, I think it'll affect the election. I haven't really thought through yet. I left the cognitive load at the minute to really think through to November. But it's going to affect people's participation. It's going to affect their trust. It's going to affect which elections they're looking at. It's going to affect where they're getting information. It's going to affect, really every aspect of political life. And then the second one was about.
Well, there was the coming together and how will it impact the election? Do you think that there will be any convergence?
So, I mean, what research shows is that we need those strong elite cues. I don't want to.
Meaning what? Give an example of what that would look like.
So, we were just, we were just talking the other day, like Arnold Schwarzenegger, right? So a Republican governor who tells you to stay at home and has his adorable little donkeys, right? So the worry is not that Republicans don't listen to Arnold Schwarzenegger. The worry is that Republicans want to believe what they want to believe and then say that he's not a real Republican in response. So the concern is finding those leaders that can mobilize cross-partisan differences. This is, the Albertson and Guderian studies show us that, it's public health officials. And so you saw this nice cultural moment where we all loved Anthony Fauci or Amy Acton in Ohio. But those are short-lived moments, right? And Republicans in Ohio were trying to sort of block her powers, right? And she's getting, people roaming outside her streets, right? So it's really hard to find these public officials that can sort of articulate these rallying effects. I saw a paper this morning that religious leaders can effectively do that. But again, you sort of, the concern is the partisan division. So we think, we're thinking all the time about, how we could identify ways to to overcome partisan divisions. We ran a series of experiments, for example, endorsement experiments about if the Republicans endorse the CDC messaging, are Republicans more likely to comply versus if the Democrats endorse the CDC? And we found nothing. We called it the nothing burger file because we reported null results. We have a working paper online if you want to see it, that these partisan cues are not moving people, that people are consuming information to reaffirm their priors.
Mm-hmm. There were a couple of questions that were emailed to me about the study, and I apologize to the people who emailed them because I forgot until right now, but here they are. And it's, did you ask ask people about their receipt of any support, any economic support or financial support, like through the PPP, or any other economic policies? Those were the questions, sorry. And it might have been, so in your survey, did you ask, have you received payment through the Paycheck Protection Program, or, did you receive a check, from Donald Trump?
We did not ask that.
Okay. And those things probably weren't even a glimmer in anybody's eye when you did put it together, huh?
Right. So part of the art of writing these surveys and panels is you want to, the panel nature lets you be flexible to add new items as you go, but then you also then want to keep items to sort of track attitudes over time. Again, linking back to the bleach comment. But we do sort of we have some questions that get at economic situation, like I said earlier, when we ask about did you lose your job? Are you worried about meeting rent or monthly needs? So we have a number of items on economic precarity, and we ask them consistently, and so that we can kind of trace that difference over time.
Okay. Another survey-related question from Claire. Do you see any significant differences across age groups or gender? For example, are younger Republicans more likely to agree with social distancing than older Republicans, or vice versa?
We haven't looked at it yet. Again, the data is very new.
And even just to reiterate for people who may have joined late, the second panel survey data just came in like yesterday.
Yeah.
Yeah. Okay. Thank you for giving us this very fresh perspective on brand new data.
But look how pretty the graphs were. You can thank my co-author Tom for that. But like we did see differences in unable to pay rent. Like we can look at, it's gonna be too hard for me to figure this out now, but like Hispanics report higher difficulty in paying rent versus Blacks versus whites. These are just descriptive, and they're not relative to another. These are just sort of tallies here. Hispanics more likely to report losing a job versus Blacks versus whites. So we're seeing applying for unemployment. We do ask that. So Asians and Hispanics reporting the highest level of reporting for unemployment or applying for unemployment. We have assistance from charity, food pantry, like I mentioned earlier. So we do see racial differences. We haven't looked at age yet in that, but those racial differences, like I said on the previous slide, those disparities are something we're going to dig a lot into further, because this is not a symmetrically impacting virus. Yeah. We all have sort of come to realize.
Here's this, I think we might do this as our final question, and I apologize to the others that I'm not getting to, including Professor Danziger. You'll just have to ask Sara your question later on. And hi, Jim. But this is from an alum, Sasha Strauss, class of '94, asks, during this period, what are your students most fascinated by related to the crisis and your research insights?
Well, they're concerned, is that the word? Or interested in?
What are they most fascinated by? But concerned, interested.
I think different things. I think they're most fascinated by the campus's plans for reopening in the fall. I could say that predominates every discussion that we have, because everyone's eager to get back. Everyone's eager to, we want to have these conversations in person. I want to be able to look you in the eye and have the feedback in the form of a conversation. So in terms of like what they're most fascinated by, it's like seeing what the campus is doing, comparing as a comparativist, we're comparing UCI to UCSD to UCLA, what the other UC campuses are doing. But it's actually on that last point, we talk a lot about the racial disparities of this crisis, and how state by state you're seeing just a variety of responses that really calls into sort of question a number of elements that we see about, or a number of assumptions we have about American federalism. And as a Europeanist, I am constantly drawing comparisons to how the EU is responding versus state to states, and particularly what member states expect the EU to do. So we have those conversations about like, who's responsible? Where does the buck stop? And then where are people looking for solutions, right? So as we enter phase 2, and we talk a lot about what California phase 2 is going to look like, camps may be open, but do you trust the officials to send your kids there? Right? The science is out in terms of whether kids are vectors or not, or there's conflicting data. And so like trust is a real concern, and we talk a lot about trust and consumption of information.
Thanks. And just again, for folks who came in a little bit late, you just received the data on for wave 2, right? Your snapshot in time of like, basically, when was that? That was for like yesterday.
Yeah.
And then how many other surveys are you doing now? What are the next waves?
We with thanks to Cornell University for subsidizing a couple more waves, we have plans to do 3 more waves, and then we're going to ask some questions before and after the election.
Right, so this is going to carry right through until after the election.
That's right. And our hope then is to produce a book that can discuss the politics of pandemic politics, as we're calling it. what.
Great. And are you getting any other like short reports out ahead of the book, like blog posts or, you know, writing for Medium or Politico or something?
Yeah, so like you can follow me on Twitter. It sounds like such a cliche, but that we're releasing information sort of as we are analyzing it, because we believe that kind of getting this information out there is really useful, not just for other scientists who are designing experiments, who are running their surveys, who want to learn something about the political moment, but for the public in general, and sort of in understanding our political world as it is taking shape.
Wonderful. Well, I'm sure people are going to be very eager to follow you on Twitter and read some of these preliminary results while we wait for what's coming next.
Yeah.
Professor Goodman, Sara Goodman from the Department of Political Science at UC Irvine, thank you so much for sharing your insights and sharing this very fresh data with us. We all really appreciate your taking the time to do this. I also want to remind the folks viewing this that the recording will be up on the Social Sciences website later on today. And I want to thank and acknowledge Andy Hill and Social Sciences Computing Services for helping make all of this happen. Thank you all once again. Stay safe, everybody, and take good care.
Thank you.